Good day everyone, my name is Crystal Kibilyaga from the University of Mindanao. So today, I will be going to perform the nasogastric tube feeding. So what are we waiting for? Let's go!
Nasogastric tube or NG tube is a special tube that carries food and medicine to the stomach through the nose. It can be used for all feeding or for giving a person an extra calories. Gather all the equipment needed. But before anything else, the first step is to check for the physician's order for feeding. Perform the proper hand washing. Then after that is to identify and explain the procedure to the client.
Good morning ma'am, how's your day today?
I'm good.
Okay, so my name is Crystal Kibilyaga. I am your nurse for today from the University of Mindanao. Would you please state your name for me please?
I am Julia.
How old are you ma'am?
22.
And where did you live?
At Labangan.
Okay po.
For the unconscious patient, check for the ID band. Assess for food allergies, time of last feeding, bowel sound, and laboratory values.
Sa nuts ma'am, we have lactose intolerance po.
Place container with formula feed in warm water.
Ma'am, mag-check ko sa imong abdomen ha.
Assess for the signs and symptoms that would suggest lack of tolerance in the previous feeding, such as the abdominal distension. Raise the bed in a working height and elevate the head of the patient into 30 to 45 degree angle.
Comfortable ka ma'am?
Perform hand hygiene and wear your clean gloves. Then place the towel on the client's chest. Pinch off the tube and remove the plug, cap or clamp and attach the aseptic syringe or the syringe. There are two techniques in checking for the placement. First is to place the diaphragm of the stethoscope just below the xiphoid process and using a syringe, slowly introduce 5 to 20 ml of air and listen to the stethoscope for the entry of air into the stomach. Aspirate 5 to 10 ml of gastric content and check using a pH strip for the acidity. Before and after the feeding, you need to flush the tube for at least 30 cc of plain water. Then for feeding, pour feed into syringe barrel and allow it to flow by gravity. Keep on pouring the feeding formula to barrel when it is 3/4 empty. Pinch the tube and pour again the remaining feed till it will be consumed. Hold the barrel of the syringe approximately 6 inches higher than the client's nose and allow the medication to flow into the stomach by gravity. Only in cases when there is a difficulty of medication following through should be plunger or bulb of the syringe be used. If the feeding does not flow properly, do not force it. It may be too thick. If so, dilute with water. After tube is cleared, close the end of the feeding tube. Then cleanse the equipment and do the aftercare.
So, kamusta ka ma'am? Okay na ka?
And elevate the head for 30 to 60 minutes. Then perform again the hand brushing. Then dry your hands. Document the type and amount of feeding, amount of water given, and tolerance of feeding. Also monitor for the breath sound, bowel sound, gastric distension, diarrhea, constipation, and intake and output. Instruct the patient to notify the nurse if she experiences sensation of fullness, nausea, and vomiting.